Mask. Wear a mask to protect mucous membranes of the mouth and nose when undertaking procedures that are likely to generate splashes of blood and other infectious material. Wear surgical masks as part of standard precautions and also when droplet transmission is expected in patient care. For example, patients with TB or measles. They are loose-fitting, single-use items that prevent splashes or sprays from reaching the mouth and nose of the person wearing them. Considerations when using a surgical mask include 1. When they become soiled or wet. 2. Never reapply after they have been removed. 3. Do not leave them dangling around the neck. 4. Do not touch the front of the mask while wearing it. 5. Hand hygiene should be performed upon touching or discarding a used mask. 6. Children should wear a specifically designed mask and their oxygen saturation should be monitored. Protective eyewear and face shield. Wear protective eyewear and face shields to protect the mucous membranes of eyes when conducting procedures that are likely to generate splashes of infectious material. If disposable, discard appropriately. If they are reusable, decontaminate them according to the manufacturer's instructions. Eye protection. Use goggles with a manufacturer's anti-fog coating. They provide reliable, practical eye protection from splashes, sprays, and respiratory droplets from multiple angles. Prescription glasses can be worn beneath these goggles. Goggles must fit snugly, particularly from the corners of the eye across the brow. Contact lenses are not protective and may pose a potential source of keratitis if infected. Face shields. Use face shields which are single-use or reusable as an alternative to protective eyewear. Compared to other forms of eye protection, a face shield provides protection to other parts of face as well as the eyes. Face shields extending from chin to crown provide better face protection against splashes or sprays. Removing face and eye protection. Remove eye protection gear only after gloves have been removed. Do not touch front of a mask, protective eyewear or face shield because it is contaminated. The ties, earpieces, and headband are relatively clean and can be touched with bare hands. Cleaning reusable face and eye protection. Follow manufacturer's instructions. Generally clean with a detergent solution. Completely dry them before storage. Caps and boots or shoe covers. Wear caps and boots or shoe covers where there is a likelihood that the patient's blood, body fluids, or other infectious material may splash, spill, or leak into the hair or the shoe. Launder caps and shoe covers appropriately if they are reusable according to the institutional policy. Discard used caps and shoe covers in red bag. Do not reuse disposable caps and shoe covers. Clean reusable boots. Patient care equipment. Handle patient care equipment soiled with infectious materials with care in order to prevent exposure to skin and mucous membranes, clothing, and the environment. Clean and disinfect all reusable equipment as per manufacturer's instructions. Linen. Handle, transport, and process used linen that is soiled with infectious material with care and ensure that there is no leaking of fluid. Selection of PPE. Selection of PPE should be done based on 1. Proximity to the patient and/or infectious material. 2. Likelihood of contact with blood or body fluids. 3. Risk of transmission of infectious pathogens. This video will demonstrate the sequence of donning and doffing of PPE from the US CDC guidelines. Donning of PPE. The first step in donning of PPE is good hand hygiene. Follow all steps of hand hygiene before wearing personal protective equipment. The second step is donning the gown. Gown should be fastened at the back of the head and the waist by tying the ends. The third step is providing respiratory protection. A simple way is to use procedure mask. They are used for droplet precautions. Droplet precautions are used in the care of influenza patients. To apply this mask, gently crease the metal insert to create an indentation for your nose. Then cuff the elastic bands or tying ends around your ears and spread out the mask across your face from bridge of the nose to below your chin. Finally, ensure your mask is snug and comfortable over your face. Procedure masks also come with an eye protection. This mask is applied in a similar fashion. N95 respirator masks act as small filters to prevent passage of particles into the airways of the person wearing them. Only correct size respirators should always be used. Place a respirator over your nose, pull the strap and position one across your head and the other across the base of the neck. These elastic straps should be in touch with the skin of the head and remove any hair in the way. Press the mask along the edges to seal it with the skin. Finally, breathe deeply to feel any area where air is escaping out along the edges. Facial hair interrupts the seal, and even a small amount of stubble may compromise the protection from pathogens. If the respirator you selected does not contain eye protection, then a separate eyewear must be worn to protect from splashes or sprays of infectious material. Protective eyewear may be safety glasses or goggles. Many shapes and styles are available. The final step in the procedure is wearing gloves. Ensure that the cuff of each glove covers the isolation gown. A secure grip is important for protection while providing care to the patient. Before entering the room, please ensure personal protective equipment are securely fit and comfortable. This will help you prevent adjusting your personal protective equipment while you're working. You're now ready to provide care to your patient. Let's have a quick review of donning the PPE. Doffing or removing of personal protective equipments. All movements in doffing should be done in a slow and intentional manner. This is to prevent aerosolizing any pathogens released while doffing the PPE. The first step is doffing the gloves. The gloves are removed first because they are likely to be the dirtiest item and are contaminated on the external surfaces. A. Grasp the first glove on the external surface at the cuff and gently peel off. B. Hold the removed glove in the other gloved hand. C. Slide the finger under the gloved hand at the cuff, touching its clean side only, and gently peel off the second glove. D. Discard the gloves in the appropriate waste bag. The second step is to remove eye protection. The glasses or goggles are contaminated on the outside. So touch only the earpieces or elastic bands for removing them. Eye protection should be discarded or placed in a designated area for disinfection and reuse. The third item is to remove the gown. The most contaminated area of the gown are the front and the sleeves. A. Unfasten the ties of the neck and waist. B. Slowly remove the gown by rolling it away from your body with the clean side out in the form of a bundle. C. Discard it in appropriate waist bag. D. Ensure the entire gown is inside the waist bag. E. Gowns hanging outside are a risk of contaminating the environment. The fourth step is the removal of respiratory protection. A. Touching the front of the mask should be minimized during removal. This is because this area of mask is contaminated with pathogens. B. When a mask or respirator has two elastic bands, then remove the bottom one first. C. Discard mask in waste bag. Finally, perform good hand hygiene immediately after removing all personal protective equipment. Let's have a quick review of doffing personal protective equipment. The summary. Personal protective equipment or PPE refers to a variety of barriers used alone or in combination to protect mucous membranes, airways, skin, and clothing from contact with infectious agents. They provide protection for both healthcare workers and patients. Selection and use of PPE is based on risk assessment and potential pathogens. Always use the correct method of donning and doffing of personal protective equipments. Never wear personal protective equipments outside the area of use.